Greetings and welcome back to the For Health Scholars channel. This marks day 5 of a series that I'm calling CAREERMAS, and I'm super excited to be sharing today's video. Today, we're going to talk about program managers and if it's a suitable role for you as a healthcare administrator, a manager, or public health professional. If this is your first time tuning into the channel, welcome. My name is Dr. Orobosa, and I'm super excited to have you here. Make sure to like and subscribe and turn on your post notifications. Watch the videos that you need. If you have questions, just drop them in the comment section. I do make it my mission to answer comments. And once again, welcome to the community. So as I stated, we're going to talk about program managers, but before I jump into the conversation, here's a few words from our sponsor. Greetings, health scholars. Today's episode is sponsored by my course, which is titled From Healthcare Graduate to Hired. Are you a professional looking to work in the healthcare industry? Or are you a current healthcare professional looking to pivot into a different sector of the healthcare industry? If you answered yes to one of the 2 questions I just asked, guess what? This course is right for you. In the For Healthcare Graduate to Hire course, it is a 90-minute video program. So yes, I kept it short and sweet, but I've loaded it with a lot of information, including give you a detailed strategy, as well as actionable steps for implementation that will help you go from healthcare graduate to job seeker to hired. In addition, I'm sharing my experiences of working in various healthcare positions, as well as the strategies I have given over 100 plus professionals that have helped them land their first, next, or even dream healthcare job. Now, what can you expect inside of the course? We're going to talk about everything from preparing your job hunting strategy down to finding the right healthcare job for you. In addition, I'm giving away a few course bonuses, which includes access to an exclusive recruiter directory. So we're giving you the name and contact information to healthcare recruiters who you can work with to help land your next healthcare job. In addition, you're going to get access to the For Health Scholars job board, as well as a live Q&A session with me, Dr. Orobosa, to answer any questions you may have. So I hope this sounds good to you. And if you are a job seeker who've been applying to healthcare jobs within the last 6 months without any response, guess what? This course is right for you. To sign up, you can access the link in the description box. And if you have questions, you can also contact me at forhealthscholars@gmail.com. I hope this is helpful, and I look forward to seeing you in the course. All right, so we are back. And as I stated, the conversation today is focused on program management and what it takes to be a program manager. And this is a role that I also have experience in. This was a role that I did before I became a full-time professor, and I enjoyed it and it taught me so much. So let's jump into the conversation for today. Program managers are the project management leaders in healthcare. I'm going to say it, and I'm saying this with my full chest. Program managers are the project managers in healthcare. And here's why. As a program manager, especially in the healthcare entity, you are responsible of managing programs across different healthcare sectors within the healthcare system. And the types of organizations that you may work in vary, but you are the individual who are taking this program, aka project, and making sure that it's running efficiently. You are completing tasks. You are thinking about ways on how to generate revenue for this department. You may be responsible for hiring, but not so much. As a program manager, you're really focused on ensuring that you are creating programs or helping the program stay afloat, keep it running. Now, as a program manager, you are a multi-talented professional because you need to pull knowledge from so many different places across the healthcare spectrum. But for the most part, you must have great project management and decision-making skills because that is what's heavily required of you as a program manager. Now, some of the typical departments that you can work in as a program manager can be everywhere from risk management to behavioral health and mental health facilities, health information technology, public health. So if you're a public health professional and you're wondering, okay, what job can I do? Program management can be a great role for you. It requires you to use your public health expertise to help run community-based organizations. As an example, the list goes on and on. Even as an educator, if you're into training and teaching and developing people, talent management and talent development, you can be a program manager there. In my role, I did trainings as well as a program manager. So it is multifaceted, and you have to be on your toes and be a out of the box thinker. That's what I will tell you from my experience being in the role. Now, here is additional job descriptions of a program manager. So, typical program management job titles can include project manager in healthcare because the program is the project and you're managing the program, aka the project. Or they can just call it program manager. Program coordinator is another interchangeable term that they use to identify program management, healthcare program lead, healthcare program manager, clinical program manager. But I wanted to add something with that. Sometimes when they say clinical program managers, they're looking for individuals with clinical degrees and licenses. So I see this a lot for clinical managers. They want you to have some type of nursing experience. So just double check the degree requirements. Some clinical managers, they're asking for administrative professionals to come manage a clinic. So you just make sure that you're reading these job descriptions if you are coming across a program manager job that says clinical program manager. But most of the time, I have been seeing them say like nursing degree, clinical program manager. Just keep that in mind. Now, the typical program manager position summary can include everything as they're looking for someone who may be under the supervision of a program director. So that was the situation in my case. I was a program manager, but I reported to my program director. I actually reported to a few people by the time I really exhibited my skills and grew the program. And so outside of reporting to my program director, depending on the project I was working on, I reported to the VP of the facility, VP of business development, marketing. I mean, there was different people that I started to just report to because of how I was really growing this program. But for the most part, for program managers, you may have a program director that you have to report to, but you'll also be responsible for successfully delivering a healthcare plan in the ecosystem using your time, budget, and client satisfaction. That is key. So in my role as a program manager, I was a program manager for a case management department. I worked with social workers and I had a program director. Our clientele were community based patients who needed case management services from social workers. So your role will require you to be adaptable and be able to adopt change quickly. Also, another position summary was that the manager will oversee the management of the case management department. So you may work with social workers depending on the facility that you are or the program that you're managing. You may have to manage third-party vendors. In my role, because of how well I was doing my job, now I had the responsibility to work with external vendors and coordinating the social workers to have care with the vendors. I even became a notary in that position. And as a notary, I was able to notarize documentation. So we kind of made the process really smooth for our clients. So I'm just sharing this with you to just tell you the flexibility and the dynamic of the program management. You are a project manager within a program. What are some of the program manager qualifications? Well, it depends on the organization. So you must have a degree or equivalent in education, experience in program management, health administration, public health. A master's is really preferred. Having a minimum of 1 year of experience in managing programs. From what I've seen, strong knowledge of healthcare systems, and even having project management skills or certifications. The certification will really help you. And of course, having great communication, strategy, decision making, and problem solving skills. Now, what is the average salary of a typical program manager? And it really depends on your organization, what type of program you're managing. So, like health information technology, if you are into digital health and you're good with electronic softwares and digital products, those program managers over there make top dollar. Whereas a program manager for a smaller clinic, the salary may vary. But across the board, across the US, the average pay for a program manager is about $78,000. So it's an upper tier type of salary. If you have less than 1 year of experience, on average is about $66,000. If you have more than 10 years of plus of experience, is about $110,000. So with this role, you can make well into the six figures or more. It just depends, once again, on the organization, the type of program you're managing, the budget of that company, etc. So who are the typical organizations that hire program managers in healthcare? Nursing homes, hospitals, outpatient facilities, insurance companies, consultancy firms as well. And this is not an exhaustive list. There are many organizations, but these were the ones that just came to my mind. And so, if you're wondering, is program management right for me? Can I be a program manager? I will tell you, if you feel like you have great problem solving skills, you're able to have ideation skills. So, being able to come up with new ideas to help transform this program for the good or to be able to remove problems as they arise. So you can be able to provide great leadership and communication skills, then program management may be right for you. So if you have questions, drop them in the chat box. But until next time,